Time now for the business spotlight on the WMAY newsfeed. It's sponsored today by the SIU Center for Family Medicine. Dr. Careyana Brenham is joining us today. Thanks so much for your time. It's great to talk to you.
Well, thank you for having me. I appreciate it.
We've got a particular focus on women's health, and we want to talk in some broad terms about this issue overall. Are there specific areas of main focus when we talk about women's health that women ought to be thinking about for their overall well-being?
Yeah, I think the biggest thing that we talk about within family medicine is just making sure people are thinking about their overall general preventive health too. So with family medicine, trying to check in with your provider, your family physician, or whoever you see as your provider, to just touch base and make sure that you are keeping up to date on all of your preventive health things like doing cervical cancer screening, which a lot of people think of as their pap smear, so getting those done. Doing breast cancer screening, so mammogram, or if there is concerns, a breast exam if it's needed. Doing things like, for those that are, over 45 or 50, looking into colon cancer screening and what to be done for that. Then we always talk about at those preventive health visits, things like vaccinations and, maybe potentially some screening labs, screening for diabetes, see how people's cholesterol is doing at that time. But most importantly, we talk about what are the things that you can do at home and on a regular basis to live the healthiest life, eating healthy, staying active, exercising, not smoking, all of those general healthy lifestyle habits to follow. And sometimes it's nice to be able to review those with your provider.
It's such an important thing, but it's also difficult. The busier we get, the more full our lives are. And particularly over the past year with the pandemic, it's kind of disrupted all those normal routines. How big a challenge has it been in your experience for women to be able to successfully keep up that kind of regimen of preventive care?
Yeah, I think everybody has struggled with the pandemic in the last year with trying to keep up with regular exercise, especially those that may have, depended on going to gyms or to yoga studios or other type of places to do that exercise. With a lot of those places closing down, people were struggling trying to get in for their regular exercise and being locked up at home. Maybe those that were working, outside and different places now working from home and being on a computer all day, just really limits that getting up and moving around and being active, being with coworkers and getting up and moving around. Sometimes it's, we found ourselves eating more snacks because you were sitting there. So I think this past year has been really tough on everybody with trying to follow those healthy diets and lifestyles. And so, as things are starting to get a little bit better, as things are opening up, hopefully as we start to get a little bit nicer weather, trying to get out and get back into those healthy habits again, I think are important.
You mentioned all of those medical screenings, again, vitally important, but it's a lot to keep track of. And it does seem like sometimes the guidelines change in terms of who should be doing it, at what age they should start, how often they should be done, et cetera. What are some good resources to make sure that people are really up on the most accurate information for knowing when and how to get those screenings taken care of?
Yeah, no, I agree. Sometimes it's really difficult to know kind of what you're due for. I would say just as a start, we don't expect patients to have to worry about those things, and you let your provider stay up to date on those. If you go in for a yearly check, your provider is going to look through everything that you, based on your age and risk factors and everything else, are due for at that time, and they should be the ones looking into that and seeing what you may need. But some of the resources that we use in family medicine that are really good are the U.S. Preventive Services Task Force. And it's a very easy site to go to and to look. And they do an excellent job with evidence-based medicine, looking into what the resources say, what the studies have shown as far as screening resources with many of those things that I have mentioned. You can get a lot of guidance from a lot of different professional organizations that are all wonderful advice. But I will say that in family medicine, the U.S. Preventive Service Task Force follows, pretty much everything, and you can really find anything on there, and so you can take a look there too. We don't expect patients to have to look at that. We let us do that. Let us be the ones to look and see what you're due for and look that up for you.
Another really important tactic, it seems, would be just being really aware of your own sense of well-being. We hear about being able to do breast self-exams, just kind of keeping track of how you're feeling, and then being an advocate for your own health and well-being. Are we, in general, good enough at that, at advocating for our own well-being with our providers? If we have a concern, going to them and saying, I really need this checked out.
Yeah, I think a lot of people tend to brush off different concerns that they have, and things may creep up on them, or they think, oh, I'll get to that later. And honestly, I think women are some of the biggest culprits of doing this. They will bring their children in, they will have them come in and get their vaccinations and their well child visits, but sometimes they'll put off their own health care in the time that they're taking care of their entire family. And so trying to encourage women to come in and to do those checks and just take that little bit of time for yourself is important, that I think sometimes we forget about. Paying attention to your body. If something is hurting, if you are not feeling right, if there are changes in, anything that's going on, GI concerns, stomach concerns, different changes to your bowels. I mean, anything that people may kind of brush off as stress or other things, maybe they are related to that, but that's exactly what going to your physician and figuring that out and letting them look into it is important to do. I think that's the biggest thing is if you are concerned, come in and have it checked out. Don't, feel like you have to be your own provider. You have to search WebMD, come in. And I know a lot of people with the pandemic were concerned about coming into doctor's offices, concerned about the safety. I will say, I know all offices in the hospitals and ours in particular are really screening people, keeping things clean, maintaining social distancing, mask wearing, everything to keep you, when you come in for your visit, as completely safe as possible so that we can still provide your health care and, get all of those important things checked, even though we are dealing still with the pandemic.
Dr. Careyana Brenham here with us, the SIU Center for Family Medicine. One last question for you, because it's never too late to get started on that path to better health. But what's a good first place to start? A good, easy first step that says, I'm making that commitment to a healthier lifestyle?
Well, like I said, as I mentioned, I think going to your doctor is a great first step because they will talk to you about what your risk factors are and maybe give you the ideas. And they're going to talk to you about where are you ready to start. There may be some people that they're smoking and they know that that's a definite place to quit, but they're not ready for it. We hope everybody is, but sometimes people aren't. Some people think, diet is where they have to go, but they're not ready for that. Maybe exercise is the better spot for them. And really getting a chance to talk to somebody about that and really having them, somebody to bounce ideas off on what's going to be most important to them. And your provider can look into, where do you stand with cholesterol or diabetes screening and give you maybe direction into where's the best, jumping point for you, and somebody to keep you accountable. That may be the person that you come back in to check in, and, maybe you go after your next goal after that.
Dr. Careyana Brenham, thank you so much. Important information here from the SIU Center for Family Medicine, sponsors today of the Business Spotlight on the newsfeed, WMAY on 92.7, 94.7, and 970 AM.